Hello, and welcome to my video. Today we're going to be talking about health education and what it is to me. What is health education? According to the Coalition of National Health Education Organizations, the definition of health education is a social science that draws from the physiological, physical, environmental, and biological sciences to promote health, prevent disease, disability, and premature death through education-driven voluntary behavior change activities. So what is health education really? When people think education, they usually associate it with the classroom. But with health education, that has not always been the case. In order to understand the full scope of what health education encompasses, you need to understand a little bit of background information. Health education hasn't always been a thing. In ancient times, people believed their health was directly associated with their behavior and how the gods perceived it. For instance, if a person got sick, they must have displeased the gods in some way. It was the ancient Greeks who began to understand the actual way to lead a healthy lifestyle. Hippocrates, yes, the guy the Hippocratic Oath was named for, separated religion from health, teaching that health was directly associated with a person's diet, exercise, and environment. Fast forward to the 19th century. In 1887, the first Institute for National Health was founded. Now, in the 20th century, in 1935, President Roosevelt passed the Social Security Act. The Social Security Act increased funding for public health services, giving federal grants to the states so they could develop their own health services. In 1948, the World Health Organization, or WHO, was founded. The 1950s brought us the Society for Public Health Education and the first National Conference for Public Health Training. In the 1960s, the legislation of Medicare and Medicaid brought public health into schools for a scientific basis of rational decision-making and training of public health professionals. The 1976 Congress passed the Health Professionals Educational Act, which helped to provide many programs for health education, and 2 years later, in 1978, the National Task Force for Preparation and Practice of Health Educators was established. In 1990, that was a big year as well, as it was the first year the Certified Health Educator Specialist exam was taken. So where might we see health educators in action? In schools, educators teach health-related subjects and develop programs to promote healthy schools and healthy choices. Health educators create environments where students learn to make good decisions for themselves and their overall health, including sexual health, mental health, substance abuse, and other decisions that affect their well-being. In hospitals, health educators explain upcoming medical procedures to patients and everything patients need to know about those procedures. They conduct training for staff and develop programs and methods to improve patient amenability, including ways to get patients to follow a doctor's orders. At work, health educators have come up with programs to keep employees healthy, such as programs to quit smoking, incentives to eat right and lose weight, and manage the stress, not just at work, but in everyday life. At the gym, health educators teach skills and rules for proper ergonomics, physiology, and the importance of physical fitness and proper diet. Health educators within community centers develop programs that encourage healthy lifestyles and reduce risks of injury or illness throughout various stages of life for people within the community. So what are some specific things health educators do? Collect and analyze data to identify community needs prior to planning, implementing, monitoring, and evaluating programs designed to encourage healthy lifestyles, policies, and environments. Supervise professional and technical staff in implementing health programs, objectives, and goals, and designed to conduct evaluations and diagnostic studies to assess the quality and performance of health educative programs. provide guidance to agencies and organizations on assessments of health education needs and on development and delivery of health education programs. And they develop educational materials and programs for community agencies, local governments, and state governments. So this is me. My name is Carla Lovell, and I'm 40 years old. What is health education in my own words? Health education is teaching individuals and communities how to live and be the healthiest they can be, even if they have to change their habits to achieve it. Why did I choose health studies as my major? I have worked in the pharmaceutical, food and beverage, and dietary supplement industry for 19 years. No, not all at the same time. Currently, I work for Avocare International, and I have finally had the chance to move up into a Director of Domestic Regulatory Compliance position. I want to know everything I can about our products and what they do to the human body, how physical activities affect those products and how they work, and I want to be able to teach people everything they need to know to maintain a healthy lifestyle. So what motivates me? It's simple. I love what I do, and I want to be the best I can be at it. What population do I want to work with? I currently work with all types of people from all types of backgrounds. However, most of them are into health and fitness already. I want to be able to help them reach their goals and motivate them to maintain a healthy lifestyle. I also want to be able to have the confidence in knowing I am able to make the best decisions for myself and my family. I can teach my children, outside a professional setting of course, and hopefully inspire them to pass the knowledge along. What specific settings do I want to teach in? On top of regulatory compliance, I am also the safety manager over my company. I already come up with programs to keep my employees safe. I want to continue on that path, teaching my employees and developing programs to keep safe, healthy, and happy.